think I'm alone, but being alone's the only way to be. When you step outside, you spin like a fighting for your sanity. This is a cold war.
Good morning, everybody. Yeah, the cold weather unfortunately means cold, chapped lips and really dry skin. So here to take us through on how to combat that and have supple skin is the beautiful Dr. Tess Mauricio. You're a dermatologist with fantastic shoes.
I know. Did you guys get that?
Look at them. Those are unbelievable. Watch out, Gaga.
Right.
So we're going to go Gaga over these tips now.
Exactly.
Where do we begin?
Well, we want to rehydrate. And as you know, I know you're looking at, is that red wine? Yes, but actually we're all done with that. We need to bring the moisture back in. We want water. Water, water, water.
So alcohol dehydrates.
Yes, it really gets rid of fluids in your body. So actually, a lot of the signs of hangovers from dehydration. So to combat that, we need to really rehydrate. And then down there is actually our humidifier. As with cold weather and heaters, we really are getting rid of a lot of the moisture that's inside the building. And actually singers like Celine Dion, they really make sure that the whole place, the concert hall, is humidified.
Really?
And you probably noticed that when you wake up, your throat and your nasal passages are dry. So you can just imagine what that type of dryness can do to your skin. So then we move on to cleansers. Obviously, we really want to move on to cream cleansers as opposed to bar soaps, and also really avoid cleansers that have benzoyl peroxide, glycolic acid. Any of those can really strip the skin from moisture. So really stick to cream cleanser. The only thing about it is that a lot of patients are used to foamy cleansers, feel like they're not clean, but really you are getting clean, you're getting rid of makeup, but you're also putting in moisture at the same time.
What about those makeup remover cloths?
Yes, they can help as long as they're not too abrasive.
Okay.
Because anything that's stripping the skin can be bad. However, we are going to talk about exfoliators, because you do need to exfoliate, get rid of some of that dead skin so that your moisturizers can be absorbed better. And the tip for exfoliators is that the larger the bead, the more aggressive the exfoliating.
So some actually they feel very sandy and gritty, like the almond shells or whatever it is. Those are not good.
Well, they can be in some body areas, but on the face they may be too much. And if you are prone to rosacea, broken capillaries, and redness on your skin, you really want to minimize scrubs. And during the winter season, people with rosacea, eczema, they really have a tough time. So we really need to, really put the moisture back in there.
So a mild exfoliator to be used, is it once a week then?
I would say once a week, and certain areas may need more, but anything more than that, you may be getting into trouble, especially in the wintertime, and especially if you have eczema-prone skin.
Okay.
And then, of course, who doesn't want more radiant, even skin tone? This product right here is called Luminaze, and it's my favorite skin brightener.
Really?
It's new to the market, and it works through a patented natural enzyme that actually breaks down the pigment in brown spots, age spots, pregnancy mask, acne scars. It's wonderful, and it really is safe and gentle for all skin types.
It's a daily moisturizer?
It's actually a lotion treatment that you put in your skin twice a day after you've cleansed, and then it really brightens the skin. It evens your skin tone. And
you are glowing.
She's glowing. You.
Whatever she's doing is working.
Right, that's my favorite product.
And how much water are we drinking a day? Is it
I would say definitely your eight glasses a day, but you really, depending on if you're on medications that cause dehydration or diuretics, or if you're working out, or if you drink a lot of coffee and tea, you got an alcohol.
Up your water intake.
Up your water intake. And then we're moving on to moisturizers. Okay, after you cleanse, after you put on your Luminaze, you want to put on moisturizer. In the winter time, you really want to do, instead of lotion, you want cream. Cream, because cream, and we have two different types. We have lotion, and you can try a little bit.
Thank you. Well, we do this. I'll give you the contact info.
Yeah, exactly. Lotions are great if you live in Florida with a lot of humidity, not in Toronto. You really want to stick to creams, because creams will actually keep the moisture locked in and sealed.
I feel better already. Thank you so much, Doctor.
All right, and don't forget sunscreen.
Sunscreen too. Luminaze.com. She needs her own show. We're out of time. I'm so sorry. Over to Jennifer at Live. I hate Jen. She's taking care of the outward beauty as well.
Right, exactly.
Woo! Outward beauty and inward beauty. We are dancing up a storm here at Glam & Gal in Ajax. 2 locations, one in Vaughan as well. Okay, Josie, you're leading the crowd. What are we going to be doing?
We are going to do the Selena Gomez girl.
What is that?
Selena Gomez is posing